So today it's our opportunity and honor to welcome Dr. Gerald Schultz for his presentation. So we welcome you, and his topic is mysterious fatal ocular and systemic infections. Welcome, sir.
Okay. Good morning. I want to share with you these very interesting, unfortunate cases. We'll start with the mystery of the missing cornea. This was a 63-year-old male that was referred to me because his condition was not improving. He was brought back to the emergency room, hospitalized, and this is what I was confronted with. No cornea. Multiple infiltrations. I did a direct swab. I was able to do it at the bedside because he was really unconscious. And this is what I grew, Klebsiella. Now let's go through Klebsiella. I know some of this was already reviewed. We're interested in a hypervirulent pneumonia because this is community spread. It's the classic ones, is hospital acquired. We're interested in the worst ones with the hypervirulent. It's gram-negative, non-motile, encapsulated. And here we can see the capsules around it. This protects the bacterium from the host, the biofilm protection from antibiotics. You can see the list of antibiotics. And the virulence is horrible. It produces proteases, matrix metalloproteases that can dissolve the protein in tissue, and it also releases collagenase. This is how it destroys the tissue, in this case, the eye. So the management after the reports with gram-negative rods were received, I used ceftriaxone, meropenem, I used everything, and still the infection remained. He was scheduled for an evisceration. His condition did not permit it. What I did is I poured betadine in it, lots of betadine, and you can see negative cultures. Finally, the family realized he was moribund, and they went home where he died in the presence of his family. Let's go into this one. Mystery of the ejected lens. I was presented with this. Here's the lens. Patient did her own cataract extraction, but you can see the way the eye looked. Again, we had inflammation in the brain. I did the same type of culture, and this is what we have of the lens. In this case, Pseudomonas. Here's the classification, and the shape is slender rod shaped. It's arranged singly or in pairs. Let's do the comparison between Klebsiella and Pseudomonas. You could read it yourself. Klebsiella is non-motile, Pseudomonas is. Klebsiella straight rods and Pseudomonas slender straight rods. Main thing is Klebsiella is encapsulated. Again, family decided not to pursue further treatment, and this patient died. Now the worst. This is the worst. And we already had lectures on fungus. This is a 30-year-old Iranian woman. She was allegedly assaulted by her guide as she was illegally crossing the Mexican border with her husband after vacationing in Mexico. A family member in the United States said, "Come, we'll take care of you, come across." Well, she was left in the desert. Husband was able to successfully get some help after an hour after she was brutalized in the desert by her guide. Emergency crew sedated her, intubated her, and brought her to my hospital. She had wounds in the legs, rhabdomyolysis of the muscle tissue, troponamines were in the body, CT of the lungs showed that it was terrible. Legs were very tense, so she had surgery. And then I was called because the pressure of the eye went up to 78. Angle closure was suspected. I did a canthotomy, reduced some of the pressure. And finally, we diagnosed her with mucormycosis, also Staph aureus. And unfortunately, this is the way this beautiful woman, who was an artist in Iran, because a member of her family said, "Come to the United States." We can see this CT scan with levels, frontal sinus opacification. She also had hepatic and renal failure and placed on dialysis. And here, this is the infection, mucormycosis, They're horrible. We can see large, irregular, non-septate, ribbon-like hyphema, and the mature sporangium of a mucor. These are the countries where COVID-associated mucormycosis has been detected. And of course, Iran, where she was from, and this thing blocked me, but that's her country. Sadly, she was considered moribund, the tube was removed, and she expired in the presence of her husband, who was totally distraught and inconsolable, since he had orchestrated this ill-fated crossing at the behest of a wealthy family member living in the United States who offered financial support if they came to live with him. It was sad. Fortunately, the ENT consultant we had was also Iranian, and they were able to converse. He was also the intermediary.
Is it over?
Thank you.
What's the most important message you want to convey to the audience?
How horrible these fungal infections are. They've got to be diagnosed early. You can see how they could infiltrate the tissue and destroy it. You can see what happened to the eye. You can see what happened to the periorbital region, and it went throughout the system. Very aggressive. And the other message is don't try to illegally cross into the United States.
Thank you very much, sir.